Bismillahirrahmanirrahim. This lecture is about subterranean drugs containing volatile oils: ginger, curcuma, garlic, and valerian. The first of all is RHIZOMA ZINGlBERIS, ginger, or rhizomatal zanjabil in Arabic.
Ginger is a dried rhizome of ZINGlBER officinale family ZINGlBERIS, which is a monocot family, deprived of the dark outer tissues and known as unbleached Jamaica ginger.
Ginger contains oleoresin from 4 to 7.5%. The oleoresin is composed of 25% volatile oil, responsible for the aroma of the drug, about 30% phenolic pungent principles, responsible for the pungent taste of the drug, and non-pungent substances. Volatile oil of ginger contains over 50 constituents, including sesquiterpenes. The pungent phenolic principles are mainly gingerols.
Upon drying, there are many changes in constituents of ginger. Curcumine, which is a constituent of the volatile oil, increases on the expense of zingiberine and sesquiphelandrine. This means curcumine increases and zingiberine and sesquiphelandrine decrease. Also, some of gingerols are changed into shugols, which are anhydrogingerols. This may provide a base for why in traditional Chinese medicine they prefer the fresh rhizome in the treatment of common colds than the dried rhizome. But no studies or no clinical studies were performed on this aspect. Upon heating or cooking, shugol and the fragmented molecule zingerone are produced.
Actions and uses. The main action of ginger is its antiemetic for the prophylaxis of nausea and vomiting associated with many cases such as motion sickness, post-operative nausea, pernicious vomiting in pregnancy or what's known as morning sickness, and seasickness. Zingerones and shugols are the main responsible constituents for this antiemetic action. Ginger and its constituents act peripherally within the gastrointestinal tract, which makes ginger preferable than the other centrally acting drugs.
Ginger is an excellent anti-inflammatory agent for the treatment of rheumatic and muscular disorders. It's digestive stimulant, carminative, and spasmolytic. Also, it is diffusive stimulant or circulatory stimulant. It is used in the treatment of colds and flu, as we said, especially in the traditional Chinese medicine, where they prefer the fresh rhizome. Also, it's used in the treatment of menstrual problems as its uterine stimulant. Ginger may affect bleeding times. It has anticoagulant effect, so it is not recommended for patients taking anticoagulants or anti-inflammatory drugs with anticoagulant effect. Ginger is not recommended for children less than 6 years of old. Also, it may cause contact dermatitis of the fingertips in sensitive patients. As we said, ginger may affect the bleeding times, and therefore it's contraindicated in patients taking anticoagulants or anti-inflammatory drugs with anticoagulant effect. It is not recommended for patients with gallstones due to its cholagogue effect. As we studied before, drugs having a cholagogue effect is not recommended for patients with gallstones. In case of morning sickness or pregnancy sickness, we have three approaches. It is permitted in British herbal pharmacopoeia without any restrictions. It is prohibited in Commission E. In case of pregnancy, no administration for morning sickness in Commission E. But in Chinese traditional medicine, there is a third approach, which may be a more reasonable approach. They permit the use of ginger, but in a dose not exceeding 2 grams per day.
The posology means that the dose of the drug for the different cases. For motion sickness, the dose is 0.5 grams 2 to 4 times daily. In dyspepsia, the dose may be increased to 4 grams per day. The second drug is curcuma or turmeric or rhizomatic curcum in Arabic. It is also a drug belonging to family ZINGlBERIS. The prepared rhizomes of Curcuma domestica or Curcuma longa family ZINGlBERIS. Curcuma rhizomes are collected at the end of the growing season, cleaned, boiled, then carefully and rapidly dried in open air. This preparation leads to many changes in the rhizome: gelatinization of the starch and diffusion of the yellow coloring matter. The constituents: it contains diaryl heptanoid coloring materials known as curcuminoids, the main of which is curcumin. Also, it contains volatile oil.
The main action of curcuma is dechlorotic, antioxidant, hepatoprotective, and a strong antihepatotoxic action. Therefore, curcuma may be used in jaundice, hepatitis, and functional disorders of hepatobiliary system. As ginger, curcuma has anti-inflammatory action, so it could be used in rheumatic pains. It is also digestive stimulant used for the treatment of acid, flatulent, and atonic dyspepsia. Curcuma may be used for the treatment of peptic ulcer due to its effect on increasing the mucin production. As in ginger, curcuma may be used in amenorrhea and dysmenorrhea due to its uterine stimulant effect. Metabolic syndrome is a syndrome which includes insulin resistance, hyperglycemia, hypertension, and hypercholesterolemia, elevated triglyceride level, obesity, especially the visceral obesity. Curcumin has been shown to attenuate several aspects of the metabolic syndrome, and you have to search for these aspects.
As in ginger, curcuma is contraindicated in case of obstruction of the biliary tract.
Curcuma could be tested for its volatile oil content with Sudan 3 histochemically. Also, it could be tested for curcuminoids using a mixture of concentrated sulfuric acid and alcohol 95%. It gives a reddish violet color.
The third drug is garlic, allium, or الثوم in Arabic. Garlic is a fresh or carefully dried main bulb with several secondary bulbs or cloves of Ilium sativum family ALLII and its preparations in effective dosage form.
Garlic contains sulfur compounds which may be volatile as ALLII or non-volatile as gamma-glutamyl cysteine peptides. Garlic contains volatile oil which is rich in sulfur compounds. The main sulfur compound in fresh garlic is ALLII. ALLII could be changed to several other sulfur compounds either through enzymatic hydrolysis or through many other chemical reactions as condensation, and in addition to sulfur compounds which may differ in the different forms of garlic, terpenes including citral, geraniol, linalool, and many other terpenes. Garlic also contains several enzymes and many other important constituents as selenium and germanium trace elements.
Actions and uses. Garlic is hypoglycemic, used as a dietary supplement for diabetics due to sulfur compounds, mainly allicin and diallyl disulfide. Also, it's a preventive measure for age-dependent vascular changes. Therefore, it's a geriatric agent. Due to, first of all, prophylaxis of atherosclerosis and the treatment of elevated blood lipid levels due to allicin and AGW, improvement of the blood flow in arterial vascular diseases as it inhibits platelet aggregation and stimulates fibrinolysis. This is also due to sulfur compounds. Treatment of mild hypertension due to selenium and germanium. Garlic is also a powerful antimicrobial agent, antibacterial, antiviral, and antifungal. Garlic, in rare instances, may change the flora of the gastrointestinal tract, leading to some gastrointestinal symptoms. The odor of garlic may pervade the breath and skin. The therapeutic doses of garlic may interfere with existing hypoglycemic and anticoagulant therapies. Garlic may potentiate the antithrombotic effect of the anti-inflammatory drugs like aspirin. It is prohibited prior to surgery due to its anticoagulant effect. Garlic is reputed to act as abortifacient due to its uterine stimulant effect, but in doses much higher than the doses used in food.
Valerian or RHIZOME Valeriana in Arabic is the rhizomes, stolons, and roots of Valeriana officinalis family Valerianaceae, collected in autumn and dried at a temperature below 40 degrees centigrade. It contains volatile oil rich in ester compounds. A number of these ester compounds may hydrolyze with time or bad storage to isovaleric acid. Isovaleric acid has a bad odor. The presence of the bad odor indicates the decomposition of the ester constituents of the drug and may be indicator for the loss of activity. As the bad odor increases, it means a larger amount of isovaleric acid, this means a more decomposition of the ester compounds present in valerian and therefore loss of activity. In addition to volatile oil, a number of epoxy-iridoid esters named valproates. The presence of isovaleric acid indicates the decomposition not only of the ester compounds present in the volatile oil, but also the decomposition of the ester compounds of the valproates or of the iridoid structure. Valerian is a powerful sedative and CNS depressant effect used in case of nervous disorders such as insomnia, stress, and anxiety. These actions is due to both volatile oil and valproates. Good luck.